In this chapter, we're going to focus on the ethical and legal aspects of professional competence and the ongoing education and training required for counselors. Although competence doesn't imply perfection, it does require that counselors have the necessary knowledge, skills, abilities, and values to provide effective interventions. We need to know what's within our scope of practice and what additional training we might need. So, for therapist competence, that means the skills and training required to effectively and appropriately treat clients in a specific area of practice. Competence, from an ethical perspective, is a requirement for all practitioners if they're to protect and serve their clients. A degree alone doesn't guarantee competence for everything. Counselors must assess how far they can go with a client and when to refer. However, if you end up referring all clients you have difficulty with, you probably won't have any clients left. As professionals, you need to monitor your competence and take steps to acquire the knowledge and skills required for effective practice. So your chapter describes a formative assessment as a developmentally informed process that provides useful feedback during one's training and throughout one's professional career. A summative assessment is an endpoint evaluation typically completed at the end of a professional program or when applying for licensure status. Together, these provide information concerning a counselor's strengths or where a counselor may need to develop educational plans. One way to develop or upgrade your skills is to work with professionals who have more experience than you do in that particular area. You can learn new skills by going to conferences and conventions, taking additional courses in areas you do not know very well, taking classes in theories you're not necessarily drawn to, participate in workshops that combine didactic work with supervised practice. Didactic work would be knowledge-based. Counselors should know their own competence. Refer when working with a client is beyond your professional training. When personal factors would interfere with a productive working relationship. When there are value conflicts. You should be able to determine whether you're competent to treat a client by the end of the initial interview. Let's look and see what the ACA 2014 Code of Ethics has to say. Counselors continually monitor their effectiveness as professionals and take steps to improve when necessary. Counselors take reasonable steps to seek supervision to evaluate their efficacy as counselors. C2A. Counselors practice only within the boundaries of their competence, based on the education, training, supervised experience, state and national professional credentials, and appropriate professional experience. Every training institution has an ethical responsibility to screen candidates so the public will be protected from incompetent practitioners. Programs have a dual responsibility to honor their commitment to the students they admit and to protect future consumers. Criteria for admitting an applicant for a program should be very clear, and the criteria for dismissing a student should also be very clear. Success in a counseling program involves more than performing well academically. Other variables include professional behavior, clinical performance, interpersonal behaviors, and personality characteristics that will support clinical effectiveness. A key role of clinical training is to promote and facilitate students' competence and professional behavior. A major problem faced by educators in training programs is identifying, dealing with, and possibly dismissing students who are not making satisfactory progress towards professional competence. A gatekeeper's role is protecting consumers by identifying and intervening with graduate students who exhibit problematic behavior. Faculty can't rely on screening procedures during the admission process alone to identify students who do not necessarily have the personality characteristics to be an effective counselor. So they should have objective evaluation procedures and processes to communicate to their students what their strengths and areas needing improvement are. When a student has good grades but demonstrates substandard interpersonal behaviors, action must be taken immediately. Unfortunately, few graduate programs dismiss impaired students. Dismissal from a program is a last resort and should only be employed after all other attempts at remediation have failed. Some barriers to taking action for dismissal is difficulty in giving clear evidence to support the decision to dismiss, concern about psychological distress for faculty and student, the lack of adequate procedures in place to support a dismissal decision, concern about the heightened resistance and defensiveness of the trainee, the potential for receiving criticism from other faculty or supervisors, lack of administrative support, and fear of legal reprisal by the student. However, if it can be demonstrated that a program failed to adequately train an individual, the university may be held responsible for the harm the graduate inflicts on clients. An example of this is on page 325, where it talks about a female therapy client who filed a suit against a Louisiana Tech, claiming that the program allowed an incompetent practitioner to graduate from the program. The client claimed that her life had been destroyed by incompetent therapy. The claim was that the program itself was inadequate and that it simply did not adequately prepare her counselor. The counselor was named in the malpractice action along with her supervisor and the university. The initial lawsuit was settled in 1994 for $1.7 million. So universities have to be really careful and monitor their students and trainees closely for competence. Of all the court cases filed by students who were dismissed from programs, those universities that won had very clear and formal documentation of the remedial actions taken in dealing with students. Remedial actions then are steps that they took to try and help them to improve where their weak areas were. Your chapter wants you to be aware of the difference between licensing and credentialing. It's important that you know the different titles. So let's just briefly look at a few of these definitions. A registry is a voluntary listing of individuals who use the title or provide service. It's kind of the least degree of regulation of practice. Although licensing and certification differ in their purposes, they have some common features. Both require specific requirements in terms of education and training and acceptance from practicing professionals. And both require testing to determine which applicants have met the standards and deserve to be granted a credential. Certification is a voluntary attempt by a group to promote a professional identity. An example of that is the Idaho Board of Alcohol and Drug Counselors certification here in Idaho. Licensure are statutes that determine and govern professional practice. It specifies what the holder can and others cannot do. It highlights the uniqueness of an occupation and restricts both the use of the title and the practice of an occupation. This means that you can't say that you're a therapist or a counselor unless you have the license to back that up. And you have to work within your scope of practice. Licensure and certification assure the public that counselors have completed minimal educational programs and have had supervised training. There are some arguments for and against professional licensing and credentialing. Those in favor of licensing and credentialing say that the public is protected by setting minimum standards of service and holding professionals accountable if they do not measure up. Incompetent counselors can cause long-term negative consequences. The public is protected from its ignorance about services that should be provided by the professional. People really don't know how to choose an appropriate counselor. Because insurance will pay for licensed professionals, more people should be able to get services. And licensing allows the profession to determine what it will and will not do. The argument says the consumer's welfare is better safeguarded with legal regulation than without it. Those against it say licensing is designed to create and preserve a union shop. It works as a self-serving measure that creates monopolistic helping professions. Carl Rogers believed that as soon as criteria is set up for certification, the profession inevitably becomes frozen in a past image. Professionals build up a rigid bureaucracy. That was his argument. Most professional organizations support efforts to make continuing education a mandatory conditioning of certification and relicensure. For example, IBA-DCC requires 20 hours a year for the CADCs, ACADCs. So let's look at what the ACA 2014 says about continuing education. Counselors recognize the need for continuing education to acquire and maintain a reasonable level of awareness of current scientific and professional information in their fields of activity. Counselors maintain their competence in the skills they use, are open to new procedures, and remain informed regarding best practices for working with diverse populations. Continuing education helps professionals stay on top of new developments in their area and keep their skills sharp. It can also be really rejuvenating. Counselors can do this by reading books and journals, attending workshops and conventions, giving presentations, participating in peer consultation groups, continuing to grow professionally and personally. They have an ethical responsibility to seek out ways to keep current with new developments in their field. Learning never ceases. New clients present new challenges. We're going to close out this chapter by looking at peer reviews and peer consultation groups. Peer review is an organized system by which practitioners within a profession assess one another's services. Peer consultation groups foster the development of skills, conceptual growth, participation, instruction, feedback, and self-monitoring. The whole purpose of this chapter is to really encourage counselors to work within their scope of practice, to stay on top of their professionalism by continuing to learn new skills and knowledge, to become more competent in working with diverse populations.